This is our video on neurofibromatosis type 1. Neurofibromatosis type 1, also called von Recklinghausen disease, refers to growths forming on nervous tissue, the nerves in the extremities and the skin. It affects roughly 1 in every 3,000 people, and the numbers of lesions are variable. You can see in the picture lesion nodules, which look like freckles on the iris, skin fold freckling, which is seen in the armpit and the groin, neurofibromas, which are benign non-cancerous tumours, and then cafe au lait spots, which look like milky coffee and are darker pigmentation on the skin. It affects roughly the same amount of females and males, and there are possible health complications, which Lauren will talk about. The causes of neurofibromatosis type 1 is a genetic mutation on the NF1 gene on chromosome 17, which codes for neurofibromin. It's found on the proximal long arm of the chromosome. Neurofibromin is the tumor suppressor gene, but now the mutation leads to fibromas, the benign non-cancerous tumours. There are 2 causes, each 50% of the cases: autosomal dominant disorder and then a random mutation in the NF1 gene. Inheritance refers to the autosomal dominant disorder of neurofibromatosis. It can be inherited from either parent. If a parent has neurofibromatosis, there is a 50% chance that the child will have neurofibromatosis. The dominant gene is stronger than a normal gene, which means only 1 mutated gene is needed. If symptoms are mild, which the parent has, they may not know that they actually have neurofibromatosis until the child is diagnosed.
To diagnose type 1 neurofibromatosis, a doctor looks for 2 or more of the following symptoms: 6 or more cafe au lait spots, 2 or more neurofibromas, or 1 plexiform neurofibroma, as shown in the diagram, freckling in the underarm and or groin, optic glioma, 2 or more lesion nodules, bone abnormalities, or a parent, sibling, or child in the family who too is being diagnosed with neurofibromatosis type 1. As many symptoms of neurofibromatosis type 1 develop with age, it may take several years to diagnose in children who do not have a family history of the condition. Genetic screening can also be done prenatally to determine early NF1. Long-term effects include malignant peripheral nerve sheath tumours, cancers such as leukemia, optic gliomas, which may reduce vision or may cause total vision loss, high blood pressure, known as hypertension, short stature, an unusually large head called macrocephaly. Skeletal abnormalities, ADHD can occur frequently in individuals with neurofibromatosis type 1 and increased mortality rate. Treatment for neurofibromatosis type 1 involves regular monitoring and may include physiotherapy, psychological support, or pain management, such as plastic surgery, chemotherapy, back brace surgery, speech and language therapist, educational psychologist, or an occupational therapist.